Again, for nursing and retirement homes, we have a section on bed mobility, if you can just comment on their bed mobility and their transfers. And then on the flip side, so the back side of the initial assessment form, we have their mobility, I guess, section at the top, so their weight-bearing status, comment on their ambulation. If they have a wheelchair, if they don't, you can circle NA. If they have a wheelchair, how is their mobility with the wheelchair? If there are stairs in the home, are they able to do them? It may not be applicable in their case. Then there's a spot for the scores for the TNEDI assessment, which I will describe later. We have a form for that. The timed up and go test, the unipedal stance test, and the 3-minute walk test. So we are looking to have more objective measures for residents, and all of these 4 scores, the TNEDI, the TUG, the unipedal stance, and the 3-minute walk test, can be entered in Coligo, and I do encourage you to enter them because homes more and more are looking for measures of improvement, maintenance, or decline in the residents, and we can actually pull those measures up from Coligo in a graphical format to show them basically how the residents are doing on a quarterly basis or an annual basis in their home, and also in comparison to other homes of similar size or similar population. So please do take the time necessary to enter those scores into Coligo. It's part of our quality improvement CQI QA program. Then there's a spot for clinical impression. This is where you would be writing obviously your analysis, what the residents' goals are, and then the agreed goals. And here we have, again, tried to make it very easy so you can check off, because in homes, especially nursing homes, they're looking for SMART goals: specific, measurable, achievable, realistic, and timely. And so here we can say we want the goals to be achieved within 1 month, 3 months, or as specified below. If there may be, all of the goals might be 3 months, except for one certain goal you might want to achieve it within 2 weeks. You can specify that beside the goal. Here you'd be circling if it's to improve or increase, prevent deterioration of, or maintain the different things that are there. So range of motion, strength, sit to stand, walking, balance. Are you looking at their objective scores? Are you looking at transfers, pain-free range of motion, chest condition? What is it that you want to work on as their goal? You can just circle and fill in the blanks as you feel necessary. And choice of treatment, again, they want to see the frequency, they want to see what the treatment is. So here you could check off 3 times a week, 5 times per week, or as specified below. And for example, if you're checking off balance program in standing with PSP, this actually is great for meeting all of our college guidelines for documentation as well, because we're specifying the frequency of the treatment, who's providing the treatment, is it the PT or the PSP, PSP being physiotherapy support personnel, which are our PTAs. And on here there's a lot of space on the right, so you can actually write down, don't just write balance program in standing, actually write, for example, standing hip flexion abduction times 10 reps, standing mini squats 10 times 5 seconds, standing tiptoe times 10 reps, hold balance 1 foot 3 times 15 seconds, right left, something like that. So it's very, very specific. That way the PTAs can take the information from here and put it on the program log, which will be described later. So if it's range of motion as well, you may be suggesting a passive range of motion for right or left, upper or lower extremity. Specify if it's into or not into resistance, if it's a stretch, or if it's for tone reduction. That's especially in nursing homes, we need to know that. But your PTAs will also need to know that, specifically to be able to choose which modality in Coligo to pull up, which passive range of motion. So here you would also write, for example, is it shoulder flexion, external rotation, elbow extension? What is it? What are the movements that you want them to do? How many reps of each? And maybe elbow extension, you may want them to do it 2 times 30 seconds instead of just 10 reps if there's actually, a stretching component involved. Be as specific as you can here so that you meet college guidelines, and so that your PTAs can take that information specifically and put it on the program logs, and everybody knows what everybody wants. For the walking program, we need to specify, is it more for gait training or is it for fitness benefits? And this is going to be filled out on the walking program information sheet that I will be describing later as well. Gait training is more, are you looking at specific components of gait that you want the PTA to practice with the resident? You can specify them here, you know, take good steps, keep walker close, things like that. Or is it strictly for fitness benefits? Maybe the cardio side of it, is it to, you know, practice endurance and things like that more so than the quality of their gait? Maybe working on the quantity of their gait, their endurance, then you would check off fitness benefits. If you're looking at doing wax or TENS or hot packs, things like that, you could put it in other or individual exercise program. You could specify if there's something that doesn't quite meet the other names of the programs here. Again, following the college audit that I had earlier this year, it is important to recognize that we have consent to do this assessment by either the resident, the family, or the facility rep. So, for example, if there's a resident that is under the public guardian or the trustee as their POA, sometimes the DOC is able to give us the consent to do that, that assessment with the resident. So just circle who you had your consent from. In most cases, I think it'll be the resident that consents to it. And beside it is treatment consented to by resident, family, facility rep. So the same thing. You'd circle who gave the consent for this assessment and who is giving consent for the treatments that will follow. And the last bit there, treatment plan and assignment of PSP to carry out plan was discussed. Yes, because the college wants us to document the fact that we actually did mention that our PTAs would be doing the treatment, so we circle yes there. Okay. Once you've done your initial assessment in nursing homes and retirement homes, please do make a note either in their electronic charting software, whether it be Point Click Care, Gold Care, Medicare, or in their paper chart in the multidisciplinary progress notes. Just make a note that the initial assessment was completed. You can give a quick summary of what you found with the resident, are they at risk of fall or no, and what kind of treatment in general they'll be getting. Resident will be seen for walking program and strengthening and balance training with PTA 3 times a week. It doesn't have to be in great detail. I would also write on there, for details of initial assessment, please refer to the residence chart, for example, or wherever this form is going to be kept in your home. And that's the initial assessment form. Okay, for the TNEDI assessment form, the same form is found in nursing, retirement, and community homes. This is the front side of the form, which is the balance part of the assessment. And then on the flip side, we have the gait part of the assessment. And as you'll see, this form, you can put 4 assessments on it. We've made space to have 4, so this is great actually, because when you go see the resident initially, you can have their first score, and then you can also have the next 3 quarters on the same sheet. So it makes it easy to look back and see how the resident has done compared to the previous quarter. We have a spot for the resident's name and date of birth at the top of both sides of the sheet according to college guidelines, so that we have a patient or a resident identifying information on the sheet. And I would ask that you print your name and sign your initials on the form. And then once you've filled out the scores, which will be 0, 1, or 2 for each of the items, just sign your initials at the bottom on both sides at the bottom, so that if another physiotherapist comes in to cover for you and does a TNEDI assessment, then we'll know which physio did which TNEDI test. So the balance score is a total of out of 16. The gait score component is a total out of a possible 12 points for a total of 28. And over in the bottom left-hand corner of the back side, which is the gait side, it tells you that a score of 18 or lower is actually a high risk of fall, 19 to 23 out of 28 is a moderate risk, and 24 or over is a low risk of score, low risk of fall. So this is actually a great sheet to keep in your PT binder, because that way you can look back and forth to see how the resident has done when you go do your next quarterly assessment on them. If you've never done a TNEDI test before, it does take a little bit of getting used to, but once you've done it enough, it becomes actually quite a quick test. I do this on all residents that are independently ambulatory, both components, the balance and the gait component. If a resident is on a walking program with, say, an assistance of 2 people, then I don't usually do the gait part because they would score so low that it's almost not worth doing. However, doing the balance part of the assessment is sometimes a good idea just to keep a baseline of how their balance is, and it also gives you an idea of what they can work on in standing. So if you're doing the tug, the timed up and go test on somebody, perhaps more so in retirement and community, and if you're doing the unipedal stance test, it's actually really well done at the end of or in the middle of the balance part before you do the gait part. Once you get to do all of the assessments, you'll have an idea for how you can actually do parts of the 3 different assessments all at the same time and not have to do them all individually. So yeah, that's the Tinetti assessment. And on now to the sensation testing form, and this form is the same in nursing, retirement, and community homes. The form is double-sided, however it's the same information on the front and on the back, and here it is. So this form I developed for myself to remind me that I needed to retest resident sensation on a quarterly basis. We do work with an at-risk population, so I do think it's a good idea. Basically, you put the resident's name and date of birth up at the top, and then if there are any medical history or precautions that you want to note there for future reference, you can put them there. You can indicate if you're testing for temperature or pain, what are the planned treatments that you need to do the sensation testing for. So there's paraffin, ice, hot packs, TENS, ultrasound, or other, and then you can write the region that you're treating. For the findings part, so you would write the date that the resident is having their test, and if you're doing hot and cold testing for temperature, there's a box that says hot, cold, reliable, hot, cold, not reliable. Then after that there's pinprick, light touch, reliable, pinprick, light touch, not reliable. So if you're testing for temperature, let's say of the hands, because you want to do wax treatments or paraffin treatments with the resident, if their sensation for hot and cold testing is reliable, you would write hands under reliable, and then just put a line through hot, cold, not reliable. And if you didn't test pain sensation or pinprick, light touch, you would just put a line through reliable and not reliable for the pinprick and light touch part. If you're testing somebody's sensation for TENS, say in their lumbar spine area, you would just put a line through the hot and cold boxes and then write either lumbar spine under reliable or not reliable based on what your test is finding. And then sign your initials at the end of the line. If you have any comments here, you can write the comment and the date that you did the comment, and then you can check off resident is safe to receive aforementioned treatment, and your name and your signature. What I have seen before is sometimes with residents I'll test a certain area of their skin and they're reliable for certain areas, and there might be a little patchy area where they're not reliable. So then let's say if I was testing for pinprick and light touch in the lumbar area, and there was a certain area, let's say, I don't know, the right lower lateral quadrant or something like that, I would write lumbar spine reliable, and then an asterisk under not reliable, and I'd write right lower quadrant, C TENS form if I was doing the TENS, the sensation testing for a TENS treatment. I would indicate on the TENS form we have a picture of the body, and I would scratch out or indicate what area they're not reliable for pinprick testing, so that way the PTA knows not to put the electrodes there. If it's for wax or some other treatment, hot packs or whatever, you can draw a little picture of the body or specifically more identify where you don't want them to put the hot pack or the ice or whatever the treatment may be, based on what your sensation testing is finding. And so on this form you have 1, 2, 3, 4, 5, you have 10 lines to be able to do 10 tests, so this form should be good for a little over 2 years with quarterly testing. I like to save paper, and so that is the physiotherapy sensation testing form. And now we'll take a look at the chest physiotherapy program form. That's what it looks like.